Hello, and welcome to the Lake Health Diabetes Education Program. My name is Marjorie Lang, and I'm the Diabetes Education Manager of the Diabetes Education Services Program here at Lake Health. The program focuses on diabetes management for those with the condition of prediabetes, type 1, type 2, as well as gestational diabetes. Today we present to you this video which discusses some of the important topics in diabetes self-management. Our team of talented diabetes educators and certified health coaches are comprised of registered nurses and registered dietitians who can help you with lifestyle change to improve outcomes related to your condition of diabetes. Contact our department today to schedule a diabetes class or an individual assessment. We look forward to working with you during this time, and if you have any additional questions or concerns related to your diabetes diagnosis, please feel free to give us a call. Thank you.
Hi, and welcome. Today we are going to talk about managing your diabetes safely during sick times. And also we're going to take a look at hyper and hypoglycemia, low and high blood sugars. But first, it's important that illness can make it hard to manage your diabetes. It is important you and your diabetes care team come up with a sick day plan so that when you do become ill, you know what to do. First, it's important to check your blood glucose. That's one of the first things that you can do when you're sick. Even if your blood glucose normally runs within an acceptable range, when you're not feeling good, it's important to check more often. Low blood sugar or hypoglycemia is caused by when you take certain medications. If you skip or delay meals can cause low blood sugar. Taking too much insulin or diabetes pills can cause your blood sugar to go low. If you're more active than normal, or if you have alcohol, those will both cause your blood sugar to actually go lower. Signs and symptoms of low blood sugar include feeling sweaty or shaky or dizzy or lightheaded. These are just some of the symptoms that patients report when they feel low blood sugar coming on. Typically, this number is around 70 milligrams per deciliter when checking your blood sugar. But that's just the guidelines. We really need you to know when you are approaching your low blood sugar so that it could be maybe 80 or 90. And we want to inform you to treat the symptoms, not necessarily the number that you're at. If low blood sugar is not treated properly, it can be life-threatening. If you do have low blood sugar, we suggest using the 15-by-15 rule. And what that means basically is you would take 15 grams of carbohydrates in foods such as a 4-ounce glass of juice, a half a can of regular soda, 3 to 4 glucose tabs. You could also chew 5 to 6 mints that you could dissolve quickly in your mouth. These are all 15 grams of carbohydrates or one carb choice. Check your blood sugar in 15 minutes. If your blood sugar is still not up above 70 milligrams per deciliter, repeat that. Again, take the 15 grams, one carb choice of the higher sugar items, and then check your blood glucose again. If after a couple attempts your blood sugar doesn't come back up, this is a time that you need to notify your doctor. Most often though, this 15-by-15 rule will help out. After your blood sugar comes back up, it's important to have a snack or a small meal to help you maintain a normal blood glucose. High blood sugar or hyperglycemia is when you have too much blood glucose and your blood sugars are running high. Overall, this can cause long-term health problems. High blood sugar can happen for several reasons. Skipping a dose of insulin, eating more than usual, if you're less active than you normally have been, or if you're under a lot of stress, or if you have illness. These would all be indications for your blood sugar to maybe go a little bit higher than normal. Some of the signs and symptoms of hyperglycemia include being very thirsty or hungry. You might notice that you're having to urinate more often. You might have blurred vision or be sleepy. You might also have infections that are slower to heal. These are all indications that possibly your blood sugar is running high. So what can you do if your blood sugar is high? Well, there's a couple of things. We recommend drinking water. The water will actually help dilute the blood sugar. You can walk around the house, do some small chores. That little bit of physical activity will help drive down your blood sugar as well. Most importantly, though, to maintain normal blood sugar, it's important to stick with your diabetes plan that you and your diabetes healthcare team have developed. Of course, the best way to know if you have high blood sugar is to check your blood sugar regularly. Taking your diabetes medicine when you're not feeling well is important. You should maintain taking all medications unless your diabetes care team advises you not to. Do not skip your diabetes pills or insulin even if you feel too sick to eat. If you use insulin, your diabetes care team may tell you to increase your insulin if your blood glucose is over 250 milligrams per deciliter. Even if you're vomiting or unable to eat, continue taking your long-acting basal insulin. If you take diabetes pills, take your usual dose. If you vomit up the pills or are not eating, call your diabetes care team and get some advice on what the next steps could be. You can always ask your diabetes care team about how to adjust your medications ahead of time so that when you're not feeling good, you know what to do. Check with your diabetes care team also, or your pharmacist, if you are going to take any over-the-counter medications while you're not feeling good. This would include aspirins, decongestants, cough medicines. You need to understand if these could possibly raise or lower your blood sugar. And when possible, choose medicines like cough drops and syrups that are sugar-free. Eating when you're sick is important. It's always important to maintain your usual eating pattern even when you're sick. If you are unable to stick to your traditional meal plan, try to eat some foods such as a half a cup of fruit juice, a half a cup of regular soda, not diet, regular gelatin, 1 cup of soup. You might also want to consider having a cup of Gatorade, the sugar kind, 1 slice of toast, or 6 crackers. All of these items are 1 carb choice, or about 15 grams. And these are great for when you're not feeling well, foods that you can traditionally eat. If you feel too sick to eat solid foods, it's important that you consume 6 to 8 ounces of liquid every hour. And what you're going to want to do is alternate 6 to 8 ounces of fluid between sugary items and non-sugary items. So for example, the first hour you would want to consume 6 to 8 ounces of juice. You will want to have regular soda. In the next hour, you'll want to consume unsweetened tea, water, or diet soda. And you will want to continue that pattern back and forth until you're able to consume foods again. If you can't follow your meal plan and you are on a liquid diet, it's important that you remember to occasionally include liquid foods that have sodium, such as broths and bouillon. When should you call your diabetes care team? Well, you can call your diabetes care team anytime, but it's important to call your health care team if your blood glucose is less than 70 milligrams per deciliter, or if after checking twice, your blood glucose still remains above 250 milligrams per deciliter. It's also important to contact your health care team if you have vomiting or diarrhea lasting greater than 6 hours, or if you have a fever that lasts for over 24 hours. Also, if you're using insulin and you have moderate to large ketones for greater than 6 hours, this would be another indication to call your healthcare team. It's always a good idea to make a sick plan so that when you do become ill, you know how to handle the situation and be prepared. Thank you for watching the Diabetes Education Series.